Hello, my name is Tyler Silvey. I am a student at Lincoln University. Today is March 31st, 2016, and it is currently 11 o'clock. Today I'll be demonstrating how to put in a Foley catheter. So, I have, for time purposes, I've already put my put my patient in supine position with their legs open. I've already performed pericare up to down and raised the bed up to a working position. I have performed patient privacy, performed hand hygiene as well, and I've checked my orders and we're ready to go ahead and put the catheter in. So, verify my patient's name and date of birth, and that's correct. So we're ready to go. I would then ask the patient if they had any questions, answer their questions about the procedure. So now it's time for me to set up my sterile field. Just going to set this here by you, ma'am, if that's fine. Always be sure to open away. I would then go ahead and put my syringe on the catheter, and I would put the lube, spray the lube out and put the catheter tip in there, but we're going to be using our fake lubricant instead. Okay. I'll then go ahead and insert the catheter. I would push the catheter until I get a flash of urine in my tube. And then I would push in an additional 1 to 2 inches. I'd go ahead and blow up my balloon. go and I'd pull it out just a little bit just to make sure that balloon is nice and secure. So then at this point I would take off my sterile gloves, perform hand hygiene, put on a new pair of clean gloves. I would secure the catheter to the patient's leg with the device that came with it, or if there wasn't one available, I would tape it. I would then take the catheter, hang it on the side of the bed, making sure it is below the patient. I would then do all my documentation that I would need to do, how much urine I got, the color, if it had any smell, how the patient tolerated the procedure. I would then hang that and make sure that you hang it on part of the frame of the actual bed. You don't want to put it on anything that's moving because it could cause injury to the patient. I would clean up my mess, lower the patient's bed, put up the side rail, and make sure that their call light is within reach. And that's how you do a catheter.